Ever pondered why, in a world obsessed with health and wellness, health education remains an overlooked subject in our education system? It's an intriguing thought, isn't it? We live in a time where we're more health conscious than ever. We meticulously count steps, calories, and sleep hours, yet ironically, health education doesn't hold a prominent place in our curriculum. Why is this the case? Well, let's delve into this paradox. We've got folks who can recite the periodic table backwards but can't tell you the basic food groups. We have people running marathons yet they're unsure how to properly fuel their bodies. It's a bit of a conundrum, isn't it? Health education is more than just understanding our physiology. It's about knowing how to keep our bodies in peak condition. It's about creating a society that values health as much as wealth. It's about time we address this oversight. Indeed, it's a question worth exploring, isn't it? Dive into the current state of health education, and you might find some startling revelations. In the United States, despite being one of the most advanced nations in the world, health education is still not given the attention it deserves. The Centers for Disease Control and Prevention reports that only slightly over half of high schools require health education for graduation. This means that nearly half of all high school students are not required to learn about basic health principles before they step into the world as adults. In communities across the nation, the situation is not much better. Many community centers lack resources to provide health education, leaving adults with limited access to essential health information. From understanding nutrition labels to recognizing early symptoms of common illnesses, many Americans are left in the dark. This lack of health education is not without consequences. Consider the obesity epidemic in America. The National Institute of Diabetes and Digestive and Kidney Diseases states that more than 1 in 3 adults are considered to be obese. While there are numerous factors contributing to this epidemic, a lack of understanding about nutrition and physical activity is certainly a significant part of the problem. Furthermore, a report from the American Heart Association reveals that nearly half of all adults in the United States have some form of cardiovascular disease. This is a staggering number, especially when you consider that many of these conditions are preventable with lifestyle changes. Yet without the necessary education, many individuals are unaware of how to protect their heart health. It's not just physical health that's at stake either. Mental health is often overlooked in health education programs, despite the fact that nearly 1 in 5 U.S. adults live with a mental illness, according to the National Institute of Mental Health. Clearly, the absence of health education is taking its toll on our society. The connection between education and health is undeniable. Without proper health education, we are failing to equip individuals with the tools they need to make informed decisions about their health and well-being. By ignoring this vital aspect of education, we are doing a disservice to ourselves and future generations. Clearly, the absence of health education is taking its toll on our society. What happens when we don't teach people about health? The repercussions are far-reaching. Imagine a society where no one understands the importance of a balanced diet, regular exercise, or the harmful effects of smoking and excessive alcohol consumption. This society is not just a figment of imagination, but a reflection of the real world where poor health education is prevalent. When people lack basic health knowledge, they are prone to make choices that lead to chronic diseases, such as obesity, diabetes, and heart disease. These conditions are not only life-altering, but also contribute to a significant portion of the global disease burden. The World Health Organization estimates that chronic diseases cause more than 60% of all deaths worldwide. Beyond physical health, poor health education also impacts mental health. Without the right information, people may not recognize signs of mental health issues or understand how to seek help. This lack of understanding can lead to delayed treatment and worsen the condition. Mental health issues such as depression and anxiety disorders are on the rise, and poor health education is a contributing factor. The impact of poor health education extends beyond individuals to society as a whole. It leads to higher healthcare costs due to increased hospitalizations and longer treatment durations. These costs are not only borne by the individuals but also by society in the form of higher insurance premiums and taxes. Moreover, poor health education also affects productivity. People with chronic diseases or untreated mental health issues are less likely to be productive at work, leading to economic losses for businesses and countries. Lastly, poor health education perpetuates health disparities. Without access to quality health education, disadvantaged communities are more likely to suffer from preventable diseases and have lower life expectancies. In essence, the cost of poor health education is enormous. affecting individuals, communities, and nations. It's a complex issue that requires collective action to address. Health ignorance isn't bliss, it's a burden on everyone. Imagine a world where everyone has access to health education. The possibilities are immense. Health education, when done right, can be a powerful tool for transformation. It is not just about learning the names of diseases or understanding how the human body works. It's about empowering individuals with the knowledge to make informed decisions about their health and well-being. It's about giving them the tools to prevent disease, to live longer, healthier lives, and to improve their overall quality of life. Picture a community where everyone understands the importance of a balanced diet and regular exercise, where the dangers of smoking, excessive alcohol consumption, and drug use are widely understood, where people know how to monitor their blood pressure, maintain their ideal weight, and manage stress effectively. This is the power of health education. The benefits of such knowledge are far-reaching. Disease prevention is one of the most significant. Many of the world's leading causes of death, such as heart disease, stroke, and diabetes, can be prevented or managed with the right lifestyle choices. These choices become easier to make when people have the right information. Increased lifespan is another notable benefit. By adopting healthier behaviors, individuals can add years to their lives. But it's not just about living longer, it's about living better. Health education can improve the quality of life by helping individuals manage chronic conditions, maintain their independence, and enjoy a more active lifestyle. There are numerous success stories of communities that have prioritized health education. For instance, the small town of Okinawa in Japan, known for its high number of centenarians, attributes its longevity to a community-wide focus on diet, exercise, and stress management. Or consider the blue zones, regions around the world where people live significantly longer than average. These communities have made health education a priority, and their inhabitants are reaping the rewards. Indeed, health education has the power to transform lives and communities. It's a tool that can bring about positive change on a personal and societal level, and with the right approach, it's something that can be made accessible to all. Because everyone deserves the opportunity to be healthy and to live their best life. So where do we go from here? The path forward is clear. It's time to reshape our approach to health education. The need for more comprehensive health education in our schools and communities is pressing. Health is more than just the absence of illness. It is a state of complete physical, mental, and social well-being. Therefore, our education should reflect this holistic view of health. Health education needs to be woven into the fabric of our school curricula. It should not be a one-off lesson or an optional subject. It must be a continuous process, integrated into every stage of a child's education. From the basics of nutrition and physical activity in early education to the complexities of mental health and preventative care in high school, health education should evolve as students grow. But the responsibility doesn't solely lie on the shoulders of our schools. Communities must also play a crucial role. Local organizations can offer workshops and seminars on a variety of health topics. From cooking classes that promote healthy eating to fitness programs that encourage regular exercise, communities can provide practical, hands-on experiences that reinforce classroom learning. Policy changes are also needed to support this shift in approach. Governments should allocate more resources towards health education and implement policies that foster a culture of wellness. This could include tax incentives for businesses that promote employee health, or subsidies for schools that prioritize health education. In our digital age, online resources also present a unique opportunity to enhance health education. Websites, apps, and social media platforms can offer a wealth of information and tools to help individuals take control of their health. They can provide access to nutrition guides, exercise plans, mental health resources, and more. The path forward is not without its challenges. It requires collective effort, commitment, and creativity. But the rewards are immense. A society that values and understands health is a society that thrives. The future of health education is in our hands. Let's ensure that we equip ourselves and future generations with the knowledge and skills to lead healthy, fulfilling lives. Because after all, health is wealth. Now that you're aware of the importance of health education, it's time to take action. It's time to embrace the power of knowledge and take control of your well-being. There's a wealth of information waiting to be uncovered. Look for reliable sources, read books, delve into reputable websites, and listen to experts in the field. But don't stop at educating yourself. Share what you learn with others. Start conversations about health in your circles. Encourage friends, family, and even strangers to understand their bodies better, to know what they are feeding their bodies and how it affects them. Let's also advocate for health education in our communities. Let's push for it in our schools, in our workplaces. Because health education isn't a privilege, it's a right. Remember, when we educate ourselves about health, we're not just improving our own lives, we're making a difference in our world.